Right now, indoor dining is shut down in the orange zone. Businesses that are considered high risk are closed. That includes gyms and salons. I asked infectious disease expert Dr. Thomas Russo if the science supports these closures.
People are frustrated that certain things are closing and others are staying open, and there's not necessarily a wealth of data to support those decisions. What do you have to say about that?
First off, it's quite clear that the situation with new coronavirus cases is spiraling out of control. And the rationale that Governor Cuomo had is by shutting these businesses down, at least at this point, hoping to blunt the rise in the curve that we've seen over the last really 5 weeks now.
But when we talk about these restrictions, they seem like the same kinds of restrictions we saw back in the spring. And I understand it worked in the spring. We got those numbers down for the summertime. So I can understand why it would be easy to go back to those same kinds of closures. But all of these businesses have gone to great lengths to try and control the spread. You hear salons say we never had one outbreak, so why are we being punished? So is it simply a scenario of it's easier to shut down smaller businesses than it is to shut down, say, grocery stores? Is that why these businesses are being shut down, or is there another reason that I just don't understand?
So let's go over the data that we know and then the plausibility in terms of why these decisions were made. So first and the easiest is indoor dining. There's actually a significant body of data that demonstrates that there's a significant increase in risk of acquiring new coronavirus infections with indoor dining. And that makes sense, right? People are going to be inside, which is higher risk of transmission, without masks for a prolonged period of time. And even with tables distanced at 6 feet, there's nothing magical about 6 feet, particularly in poorly ventilated spaces. So I think that's logical. And frankly speaking, I'm surprised that Governor Cuomo waited so long to shut down indoor dining. Gyms is a little grayer. So we have data that shows that gyms are also an increased risk for acquiring new infections. That data was primarily generated, though, earlier on in the pandemic. However, gyms, particularly when it involves aerobic exercise where people are working out hard, you're going to generate an increased number of respiratory secretions. And if mask usage isn't perfect and it's a poorly ventilated space, I'm quite concerned about that scenario as well. And so that really has moderate strength of evidence. The nail and hair salons has the weakest evidence of these three entities. I'm not aware of any studies that show there's an increased risk. I'm only speculating the fact that individuals are going to be in close contact with someone for a significant amount of time, often when you're getting your hair done or your nails done. And though everyone's wearing masks, masks are imperfect. So I think Governor Cuomo was being conservative.